15 տարի Oxfam բրիտանական միջազգային
Oxfam GB 15 years in Armenia. What was the pathway traversed? What have been the achievements, challenges, and what are the main problems encountered? To reduce poverty and vulnerability, these are Oxfam's priorities. This organization started its operation in Armenia when concrete humanitarian projects were an imperative. Poor social conditions, post-war period, refugees. In conformity with its mission, Oxfam succeeded in responding to emergency situations. Since 1994 up to 95, Oxfam's target communities have been remote rural communities where no one else works. In 1997 and 98, Oxfam embarked on long-term projects, changing its strategy over time to adapt to changes in this country and in the global context, because the latter also affected Armenia. But our mission is unchanged: poverty reduction and alleviation of human sufferance. The purpose of the projects implemented in more than 165 rural communities of Armenia is to make primary social services affordable. Oxfam promotes civil society development in communities. The Oxfam experts believe that the villagers are capable of solving their problems, provided they are consolidated and active. You should see how inspired these people are. There are communities where the people are passive. It is very hard to induce them to participate in various processes. Because the people are dejected, they don't believe they can make any positive change even if they are united. But we also have success stories. Apparently, we lay the foundation of the volunteer movement. People unite and stand up for their community and solve its problems. It may be very important to promote civic activism in communities, to ensure participation in local democratic processes, to make the efforts of the government and civil society more efficient in improving the living standards of the population. Activist groups work in communities to provide legal aid. Court cases are initiated. About 700 cases of rights violations have been discovered and resolved. These mostly concern issuance of passports, rehabilitation of parental rights, or land disputes. In other words, the problems villagers face in their daily life. They don't always know to whom to apply and how to prepare the paperwork. We have a lawyer. We work through local NGOs, civic centers established by us in villages, where people can consult on site on issues of concern. Oftentimes, it may be lack of information or they don't know how to initiate proceedings. I am glad to participate in this enjoyable event and to meet once again the people with whom we have traversed a long and hard road and who are not only partners but very dear people now. This is the paramedic of the borderline village Khachik, rather isolated from the regional center, about 40 kilometers. When public funds were insufficient to rehabilitate and equip to health post, Oxfam came to the rescue just in time. And as a result, time-wise, we have advanced significantly. Martyros and Azadek are considered to be borderline communities where we started our work. We also operate in Nor Aznaberd. It is close to the Azeri border. I work there. We work there under enemy fire. We built the health post there from scratch. We re-equipped it and gave first aid medication. We retrained the nurses.
վերազինել ենք, վերապատրաստել ենք բուժքույրերին։
կազմակերպվել
The visits of neuro specialists to villages have been organized. In case of serious health problems, immediate medical aid was provided. If a surgical intervention is required, Oxfam found a way out through a newly developed model of community co-financing.
Ունենք նաև Oxfam-ի կողմից ստեղծված 3 առողջապահական հիմնադրամներ, երկուսը մեր հարավային մարզերում։
Since Oxfam established 3 healthcare foundations, 2 in the southern provinces, Syunik and Vayadzor, and 1 in the north. These foundations were established through contributions made by the population. If there are problems requiring surgery and it is not covered by the state and the resident, the beneficiary has to pay, and if the community approves of it, they can use their funds for these purposes. We have had such cases where payments were made for specialized treatment.
Սկսվեց կանանց առողջության պահպանում ծրագիրը, գյուղեր մեկնեցին մասնագետ։
Women's healthcare project began. Gynecologists came to villages and examinations were conducted using instruments and consultations, and further treatment of discovered cases continued in Yerevan. Oxfam and disabled children. Psychological and social aid provided to about 40 disabled children. Many of these children now study and have graduated from vocational schools. Many of them have jobs. We shall be grateful for that. A lot has been done for awareness raising. It was established by Oxfam. Now they are supported by other donors. These children try to change us, the adults, our stereotypes that all the children are actually equal. This is a very solemn day for us because we work with our friends and partners, different organizations and the mass media in order to change the life of the people who need it, disabled men and women, children and youngsters. But today I want to say that first of all we shall change our lives so that we can offer the same help to others. To make the world fair and safe, to free people from poverty and sufferance, one has always strived for fair and prosperous life, and this intention has never been interrupted. Because there is inequality in any society, but in a civilized society, inequality shall not affect human well-being. This requires an atmosphere of accord. To create the atmosphere of accord, and I have seen this in Oxfam's projects, when they implemented community projects. I myself, when working in an international organization, implemented such projects, and I am very pleased to see the seeds of accord spread in the society. I believe in the near future our cooperation will acquire a new quality and new intensity. I welcome you and wish you success in your grateful mission. Congratulations and kind words were said to Oxfam not only on occasion of the Jubilee, but for the enormous hard work done for 15 years. The most important thing for Oxfam is accountability to donors, beneficiaries and supporters, and the latter are satisfied. We celebrated the 10th anniversary with Oxfam, and I believe we will have many years to celebrate. Hence, your efforts and contributions were not in vain. A good beginning is what matters, and most importantly, continuity. Oxfam believes that everyone has the right to life and security, the right to sustainable livelihood, the right to basic social services, the right to be heard, and the right to equity. Committed to its principles, Oxfam continues its mission: poverty reduction and elimination of human sufferance.